Hi, my name is George San Antonio, and today I'll be doing PO meds and injection meds. As always, when entering the room, you would introduce yourself to the patient, identify the patient 2 ways, perform hand hygiene, put on clean gloves, and provide privacy. So the first type of medication I'm going to talk about is PO, by mouth. They come in different types, these pills. There are different kinds of tablets. There are some called enteric, which you cannot crush, so you always need to know which type of pill you're administering, whether or not it can be crushed or if it has to be taken whole. Always with all these medications, you always want to make sure you check the MAR 3 times, and you always want to know the 6 rights of medication administration. So the best thing to do with these is either encourage the patient to take it with water, or if they don't need it, just take it as it is. You always want to check for pocketing and make sure you give pills 1 at a time. So the next type I will talk about will be the intradermal. With any injection medication, you always have to clean the spot first. Once you select it, you have to clean it. So the first thing I'll do here is take an alcohol swab, and this is going to go for all of them. You want to clean from the center outside of the spot and let that dry, and then that'll be good for any injection. So for our intradermal, this is going to be just under the skin. With any injection also, you want to know what you need to inject first. So I'll say 0.1 ml. You would insert into your medication, make sure I have the right medication, it's not expired. When you withdraw it, you aspirate it. It's always upside down, and you pull out the correct amount that you need. Okay. And for this one, you're going to insert it under the skin, 5 to 15 degrees. You're going to stretch the skin out. And inject the medication, and you want to see the bleb there. Okay, again, cleaning the site. The next one I'm going to talk about is your IM injection. These are a little bigger. These go in the deltoid mainly, or ventrogluteal. So we can do the same thing. I'm going to withdraw, say, 2 mLs here. So I have my syringe. I'm going to stick it in, and you always withdraw like this. Okay, there we go. This one, you're going to pinch the skin. It's going to go in at a 90-degree angle, approximately. Goes in, release, inject, and withdraw. The next one I'm going to talk about is the subcutaneous or insulin. With this one, an easy way to remember it is RN. You always want to do the regular insulin first. So I'm going to take my needle here. I'm going to do, say, 10 units with this one. You're going to put the air into the cloudy one first. Put the air in. And we're going to do it again. With any injection, you're always going to put the air in first. Put the air in. And then we're going to withdraw. Okay. And we're going to withdraw from this one. That'll be another 10. Again, with any injection, and this one in particular, to get bubbles out, you can always flick it. With this one, you can't let the medication go back in because you're mixing. So putting this one in, again, it would have already been cleaned. It goes straight in, inject, and withdraw. So the last one I'm going to talk about is your filter tip. Syringe will look like this with the filter tip on top. In order to use these ampules, you have to turn the ampule upside down first to get the medication all combined. You can roll it to combine the medication. You can never shake it. So once you've got all the medication together, you're going to break it away towards you, but away from you, so debris doesn't hit you. So use the gauze and break that. So using the filter tip, this is important, especially because you don't want glass or anything in, so that's what the filter tip removes. Just going to put the filter tip in, turning it very carefully, not to break the pressure seal. And once you withdrew it with the filter tip, you would switch this off for a needle. And again, squeeze, insert after cleaning, inject the medication, and release. Sharps are always disposed of in the proper receptacle and clean up the area.